So my name is Mahlet Frezer. I am a fourth-year medical student at Tulane School of Medicine. And today I have a case of a woman who nearly died from a completely preventable complication of a common condition. It's a condition that affects over 70% of women, and yet it is often ignored or it's treated too late. So uterine fibroids, which is a benign smooth muscle tumor, is very common, but for many, especially Black women, it can be anything but. It develops earlier in Black women. It has usually with larger size, and it is more likely to go underdiagnosed or undertreated. And when it gets to management, it usually undergoes unnecessary radical intervention because it is often diagnosed late. So this case presents a rare but life-threatening complication of uterine fibroids, which is a deep vein thrombosis secondary to pelvic vein compression. So our patient was a 39-year-old newly pairs Black woman who came into ED with a swollen right leg, and she had severe microcytic anemia. Her hemoglobin was 5.4. She was tachycardic and pale and had a large pelvic mass. It was easily palpable on abdominal exam. It was very big. Imaging revealed an extensive DVT involving the right common femoral vein, the deep femoral vein, the popliteal, and the posterior tibial. And it traced back to a mass effect of a fibroid-laden uterus, which was over 22 centimeters. And it can be seen here at the bottom. It's the center image. So once she got to the hospital, she received 2 units of blood, and then an IVC filter was placed in preparation of her surgery. She underwent an abdominal hysterectomy with bilateral salpingectomy to remove the fibroid-laden uterus. And then vascular surgery was able to perform a suction thrombectomy to remove the clot. And the clot was pretty large. That's the image on the right side. You can zoom into it to see better. So this case was not just a medical emergency. It reflects a gap in the healthcare system. Black women are 3 times more likely to develop fibroid with earlier onset and larger tumor size. They are less likely to be diagnosed early, and they are more likely to undergo hysterectomy. The delayed recognition is often associated with atypical presentation, also normalization of symptoms, and the absence of standardized early screening protocols. So in this case, the early detection could have preserved both her health, but also fertility. She is 39, never had the chance or didn't get the opportunity to have a child. So the takeaways I would like to share for this case is the importance of early screening, and especially in high-risk population, the importance of equitable access to minimally invasive treatments, the importance of culturally competent care, and a shift from reactive to more preventative gynecological treatments. And that's all I have for this case.
Nice presentation. Questions? Does anyone have any questions?
I don't have anything in the chat, Doctor.
Oh, okay, so here's a question I have. Now, this is a tragic case because the way this has developed, it was so large. So the question is, what do you think in terms of evaluating women and then hopefully saying, yes, women include all women, should there be standard screening to look at things at least once to see if this is an issue? And then if it's an issue, it can then be followed. Because I was looking at the latest, the National Institute of Health had a report that came out, and they said in order for this to be severe, the fibroid has to be as large as the uterus, and it has to be huge. So the whole point is this developing thing. What is your thought about that? Because I think this is a gap in the healthcare system.
I mean, obviously doing imaging for everybody would be ideal, but at the very basic level in primary care and just regular visits, when we asked about menstruation, it's often asked, is your flow heavy or light?
Yeah.
But that is such a subjective question that something that's considered light for someone else might be heavy for the public. So asking deeper questions such as how many pads do you go through in a week on your menstruation, or how many times do you have a change in a day, can give us a way more information than just asking, is your flow heavy or light?
No, and I think that's good. Now, here's the other question. This is very fortuitous because we had a previous nice presentation about the POCUS, point of care ultrasound. I mean, if you're doing it for the figures, why not do it for the uterus? I mean,
Yeah,
it just is a winning situation. And that's something I think, and see, that would actually be cost effective because it's putting more power of the people who are seeing the people. So then you're actually empowered. It's a win-win because the patient gets the care, plus the provider feels they're doing more total care. So you're actually getting more equipment. Does that make sense?
definitely. Yeah. That would, yeah. And it's very cost effective too. It doesn't have to get anywhere near this.
Exactly. Exactly. Well, very nice presentation. Thank you.
Yeah.
Very good. Thank you.
Please support our mission to improve quality of patient care through education. Join us, follow us, and share this content with family and friends.